To get started here in just a second. Thank you all so much for joining this morning. I am Carrie Frank. I'm the Vice President of Communication and Marketing here at Civic, and we are excited to have you guys joining us today for this webinar to discuss the facility preview period. I'm also joined in the room by Maria de Jesus Diaz-Perez. She's the Director of Public Reporting here at Civic. So we're both glad to have you guys and welcome you all to our webinar this morning. So I am going to run through a little bit more background on who Civic is and what we do, and our administration of the Colorado All-Payer Claims Database, which is where the data comes from for this preview period, and the reporting that we are going to be discussing today. Just as a background information to make sure that you guys understand where this information came from and why we do what we do here at Civic, and then also give you guys an overview of what the reports are and what the data is and the methodology, and answer any questions that you guys have regarding this preview period that we're embarking upon right now. Just some housekeeping items. You guys are all on mute at this moment in time. If you have any questions for me, though, throughout the presentation, feel free to type into the Q&A box, and I'll be sure to answer those questions. There's also a chat box as well. You can do either one. I have both of those up and available. So either chat or Q&A, and we'll answer those as we go through. So just a little bit about us. At Civic, the mission that we have here is to empower individuals, communities, and organizations through collaborative support and healthcare information to advance the triple aim. So we're really all about supporting those of you on the ground to advance health of the population in Colorado, to improve the care that's being provided, and then to lower the cost of that care. We work with change agents across the full spectrum of healthcare. So that's from anyone from consumers to researchers to health insurance companies, employers, healthcare organizations and providers and facilities like yourselves, advocacy organizations and nonprofits, and then consumers as well. So really the full spectrum, anyone who touches healthcare, which is all of us. We have two primary focus areas. One is in data and transparency, which we'll talk a lot about today in our role as the Colorado All-Payer Claims Database Administrator. We provide information through the APCD to advance the triple aim. And then we also focus on programming and convening, which is our work in care transitions, palliative care, and advanced care planning. And we also support payment reform efforts through partnerships and providing data and support. So just a little background on the APCD in case you're unaware. In 2008, the APCD was recommended by the Blue Ribbon Commission for Healthcare Reform. That was actually enacted into legislation and passed into legislation in 2010 through House Bill 10-1330. And at that point in time, Civic was named the administrator by the State Medicaid Department, or HCPF, as most of you probably know them. And then in 2012, we were able to actually operationalize the website. For the first time, we got all of the data in from the first 8 commercial payers at that point in time and Medicaid. And then we began providing custom requests in 2013. At that point in time, and between 2013 and really 2016, we did a lot of infrastructure development. We added a lot more commercial payers. We were also able to bring in Medicare fee-for-service and increase the number of custom data fulfillments that we were able to provide. And really since 2017, when we transitioned to our new vendor, we were able to really enhance our capabilities. We launched the new website that we have available now. We added a lot more public data, and then we were able to launch our first consumer-facing, or actually our second round of consumer-facing price information. That happened in July of last year, and then this is our second round of consumer-facing information. And we really have increased the amount of public information that we've been able to provide, not only to consumers, but then also to those of you who are working in the healthcare space to identify opportunities for improving care, lowering costs. So what's in the APCD at this point in time? We have Medicaid, which is the Health First Colorado. We also have Medicare fee-for-service and Medicare Advantage in the claims data. And then we actually have close to 40 commercial payers at this point in time. So those are the largest commercial payers. That's a lot of claims data. It's near 800 million claims at this point across medical, pharmacy, and dental claims. And we also have the majority of insured lives in Colorado. The breakdown of that is on this next slide. If you look at what's actually in the APCD, it covers about 77% of total insured Coloradans. 23% of the people insured in Colorado are not represented in the claims, and that is primarily because we don't get two sets of claims in our database on the mandated basis. We do not get any federal programs, so that includes like VA, TRICARE, Indian Health Services, and then we only are able to voluntarily accept self-insured employer claims, so that represents about half of all commercial insurance, but we are getting about 24% of the self-insured claims. That's that purple bar that you see there. So we are getting self-insured in the database. We just don't have all of them because of the Supreme Court decision that we're not allowed as any state to mandate that ERISA-based claims are submitted to a database. So right now, though, we're engaging a lot of employers. We expect that over time, we're going to build that self-insured warehouse in the database and be able to get more and more of the self-insured claims into the database. So what we do with the data is two things. We provide both public data, which we'll talk about a lot here today, through our interactive website, our SWOT analysis and data bites, and our infographics and other publications. And then we also provide non-public data. So those are custom requests that come to us from any type of stakeholder, and we provide that information in a variety of ways. Sometimes it's data sets, sometimes it's a standard report that we've already developed, sometimes it's a custom report. So we provide data both publicly and non-publicly. And as you're aware, we're talking about today the public data, which we are excited to be able to provide because we think that there's a lot of value in being able to provide information without charging for that. We would like to do that as much as we possibly can. That's part of our role as our administrative role at the APCD. We are mandated to provide public data on cost, quality, and utilization. We've expanded beyond that, and we've also been able to provide additional support in chronic conditions and other areas. And then we also will have the mandate to provide consumers with information on how to shop for care, and that's what we're currently doing with this preview period is our next release of shoppable healthcare experiences. So what we're doing in the public realm really is, we want to educate consumers and other stakeholders about healthcare issues. There's a lack of understanding on the patient side about what goes into healthcare pricing and that they should be engaged in making those decisions. We want to also inform opportunities across multiple stakeholder audiences for cost savings and improved health and healthcare. Also just to support decision making, because there's a lot of opportunity in improving and advancing the AAA, but it's hard to understand where to start sometimes, so that public information kind of gives communities and organizations like yourselves an opportunity to look at where your county or your region might stand on different metrics and see where you have opportunities to advance the AAA. And then also to track progress. We have claims data from 2009 through the current month of claims that we get submitted on a monthly basis. So we're really able to track progress as a state and across communities to see where we are, where we're going, if we're tracking in the right direction, or if we have maybe some other opportunities to change our trajectory. So just a little history of what we're talking about today on the facility price reports. We first released the data for consumers to shop in 2013. That first release was inpatient-only costs for 4 services. So we only had 4 things that were inpatient facility only. It was hip replacement, knee replacement, burst, vaginal, both vaginal and cesarean burst. So that was our first release in 2013 when we had our original vendor. We, since then, have been looking at what we would like to move towards with our public reporting as far as consumer shopping experiences. And we were able to do our second release in July of 2018, and that's what we currently have on our website, which is 13 imaging services. Mostly those are MRIs and CT scans that are commonly performed across the state. We also have some ultrasounds and bone density as well. So I'll be showing you where that currently lives on our website here in a second. And now we're in our next preview period. The current preview period is scheduled for release in January of this year. So we're aiming for mid to late January, which is now this month. It's crazy to think. But that is going to be Prometheus, inpatient and outpatient, and have the current imaging procedures updated to 2017. And then we'll be adding also additional X-ray procedures that I will be showing you too. And just so you know, our philosophy at Civic is we want to always make sure that those of you who might be named on our website, that you are fully aware that this is coming, that you have an opportunity over our 30-day preview period to make sure you can check out your data, understand the methodology, dig into it, make sure it makes sense to you, that it accurately reflects your facility information. And then, you know, answer any questions that you guys have. We're more than willing to meet with any of you guys one-on-one as well to dig into your information even further. So this is your opportunity during this preview period to do that. So the direct URL for where this information is ultimately going to live, it's on our website right now at civic.org/shop-for-care. But it's easier probably to just get to it from our Get Data tab, Public Data, and if you hit Interactive Data, you'll find the Shop for Care page on our website. So that's where it lives. The current view of the information looks very similar to this. This is a screenshot of the current live data. If you go to that page I was just showing you, we have this list of MRIs, CTs, ultrasound, and some bone density and heart vessel information. So what we'll be doing is updating this current data to the 2017 and then adding additional measures as well. So this is a summary of what will be going live. We have new Prometheus episode data, that's that left-hand box. So that list of services across inpatient and outpatient will be episode-based. We'll talk a little bit more about what that means here in a second. That will be 2017 calendar year data across just commercial payers. We'll also be adding new imaging, which is mostly X-ray services that you see there as well. That's also going to be 2017 data. And then that last column there will be the current imaging, which you just saw a second ago. That will be updated with 2017 data. So everything will be 2017 data. The difference will be that Prometheus episodes are based on a full bundle of care, and they will encompass multiple aspects of that procedure, including both professional fees and facility fees, whereas imaging data is only going to represent the facility portion of the CPT codes that we are basing this information on. So to access the actual facility price and quality preview period, you guys received the email that we sent out, or you probably wouldn't be on this webinar at this point in time. So that URL is in the email that we sent to you, but here it is again, just in case. And then the password that you have, you just enter that password into the password box, and then you will see the report exactly as it will be when we go live with it towards the end of this month. We also have a lot of resources for you as well. FAQs and methodology, which is a lot of what I'm talking about today, is outlined in the FAQ document. So feel free to take a peek at that if you have any questions later. And then we also wanted to make sure you guys have the ability to download all of this data in an Excel spreadsheet. So the download procedure episode data reflects the Prometheus bundled episode data, and then the download imaging data will give you all of the imaging procedures. And that'll allow you to sort by your facility easily and quickly and see where you are for each of those procedures without having to go one by one and see if you're showing up for each one. You can just download all the data. So just a little bit more information about the types of procedures and what it represents. All of the imaging services that you will see, again, will represent 2017 calendar year claims in the ABCD. Those are all commercial claims only, so you haven't included Medicaid or any other payer type. It's all the commercial claims that we have, which again represents 100% of the fully insured and about 25% of self-insured. That represents about 1.5 million lives and 65% of all commercially insured payers, or commercially insured Coloradans, excuse me. As I mentioned, also, the imaging services are only going to be reflecting your facility payment, and that is across both what the plans paid you and what the member liability was combined. So we have taken both of those things, added them together. It does not include any professional payment, so it's not going to include any of the charges that might happen for reading the scan or anything like that. It's just your facility only payment. What you will see on the report reflected is average price, a column that's average price, and that actually reflects your median paid amount. We always report on median so that we remove the outliers. But then we also know that patients may not pay just that median amount, or they may not pay that between themselves and their health plan. So we also reflect the price range, which represents the 25th to 75th percentile. Again, we do that to eliminate outliers on both the low and the high end. And those, again, all represent paid amounts that you would have received from commercial and members and patients. So Prometheus is a little different. It's also some of the same things apply. It's also a 2017 calendar year claims. It's also the same commercial claims that are included, 100% of the fully insured, 25% of the self-insured. But instead of just being your facility only payment, which is what the imaging services represent, the prices that we are showing for Prometheus, which is other procedures on the site, include the full episode. So what the episode is defined as is different for each of them. And if you're interested in understanding more, there's a link at the bottom to where the Prometheus analytics is, and we can send you more detail if you have questions regarding a specific episode. But what it's looking at is anything that happened before the procedure, during the procedure, and then afterwards, according to what the episode is defined as. So it will include any payments that were made to any doctors that the patient saw before, any facility charges that were related to that service beforehand, all of the fees associated with the actual procedure, both facility and professional, any ancillary services that happened as well, labs and things like that, and then including anything that occurred afterwards, post-op services, including PT or rehabilitation services and any fees associated with that. So again, it includes the plan paid and the member liability. The average price will again represent what the total median paid amount was for that service. And the price range is the 25th to 75th percentile again. The way that Prometheus associates the service or a claim to your facility is called a trigger event. And so if the actual procedure itself happened at your facility and there's enough data to show what happened during the pre-surgery period or pre-procedure period and then the post-procedure period, then that gets assigned to your facility as a claim. So in addition to the quality measures, I'm sorry, in addition to the actual cost measures and cost information, we also know that it's not the only thing that people should be considering and patients should be considering as they're selecting a provider. So we also wanted to make sure we had a quality measure as well. What we are providing at this point in time is the publicly reported patient experience collective measure that CMS reports on their website. So those of you who might be ASCs who are on the line, or imaging centers, or you are maybe Children's Hospital who doesn't service Medicare, you aren't required to submit this information. So unfortunately, there won't be a similar experience measure for you, but we have put that in the notations that that's why that's missing. We right now have that annotated as an asterisk. You can see that down there on the bottom. That would be where we have the missing facility information. We've had feedback that a star asterisk is too close to the star and is confusing. If people see that, they might think that that's just a 1 star. So we're actually going to change that to make that more of a dash or something very different, so that it's not a confusing thing when patients look at that. But that patient experience is the most updated CMS reported measure for patient experience. Ultimately, we would love to have more information for ASCs and imaging centers as well. So if you do represent an ASC or an imaging center and you do collect a patient experience metric, or more, multiple metrics, we would love to hear from you and understand what you guys are collecting, because we'd love to be able to collect that from your facilities as well, so that it's not a blank slate there, and we can accurately convey a similar quality measure for you. We'll also be looking at other rating systems as we go further down the pike. CMS stopped reporting on their hospital 5-star rating. We were originally going to be reporting on that as well, but I think they are getting ready to relaunch that sometime this year. So we have plans to update that as well later on in our public reporting. So I want now to go, and I want to remind you guys, if you have any questions, please feel free to either chat or Q&A, either one. Would love to take any questions that you guys might have. But for now, I'm going to take a minute to pop out of our slides here and go to the actual website so that you can see. So right now I'm showing the facility price and quality preview, but let me pop over to actually where this lives so that you guys can see that as well. So this is our website, civic.org, and again, where you will go is to get data, public data, interactive data, and shop for care. There's also a link to it right here on our homepage. You can see the facility cost information now available. That's another place that consumers might see this information. So this is our current Shop for Care page. We have like some intro language, and we always put some considerations, which I want to make sure that I mention. We know that this information is a lot to digest for patients, and especially with the update of Prometheus. So we'll be updating this to make sure that they know that some of the procedures are all in, some of the procedures are just the facility fee. We always want to make sure that patients know that for specific price information, contact your insurance company or the facility directly, because obviously this won't reflect the amount that they're going to actually pay, but we think it's important for them to understand the total cost anyway, because that drives their premiums in the future. So right now we have the list of just the 13 or so MRI CT scans. You have the ability to select zip codes of choice. You can sort this list by facility, A to Z, closest distance. You can sort by average price, high to low, low to high, and then also by that patient experience. And we selected this layout and this way of providing this information based on best practices across the state, and also just talking to consumers and doing some focus groups on what information they like to see. So Simple is better when you're providing information to consumers. So there's a lot of information we could provide right here on this screen, but we've chosen to make it very simple, to stick with average price and then price range, and make sure that they have clicks to links that they can dig into more and more detail if they choose to do that. But best practices show that you need to kind of start high level, keep it really simple. So that's our approach on this. So here you have the facility price and quality preview. So this is the link that we were just talking about a second ago that you have in your email. This is the information that has not gone live yet, but that we are planning to go live with towards the end of this month. So here is it. You won't see the considerations, and it doesn't have all the links and things that will be available eventually, but this will show you the report in the way that it will be displayed on the website later this month. The imaging procedures, as I mentioned, so they're going to be expanded. You'll have the current set, a lot of the CTs and MRIs that we had before, but then expanding to x-rays. And we're going to make these, before going live, a little bit more user-friendly and alphabetized so that patients aren't having to understand which CPT code. You don't have to select by that, but they will actually be able to go, okay, x-ray of the neck and spine, and that will be more user-friendly. Same selection options here, same sort by options as well, and same information as far as patient experience, average price, and the price range. You have the ability to scroll down, and as I mentioned, you have the resources down here that you can actually download some of this data, or actually all of it. So if you're interested in just the imaging, you can download the imaging, and then you can also download the procedures as well. And here's that FAQs and methodology. So the new feature here is really this other procedures, which is the Prometheus-based episode bundle. So we have both of those available. So if they want to view imaging, they can. If they want to look at other procedures, they have that ability. Again, a different list here includes all of the inpatient and outpatient services that we just mentioned, and similar views of the data will be available. So I want to pop back over to our slide deck. So that's your ability to look at this information and dig a little deeper into what will be shown for your facility. So we get a lot of questions regarding why you may not be showing up for procedures that you actually do a lot of, and that's a common issue and concern, and there's a couple of reasons why that might be the case. So I wanted to just review that. So we use the CMS suppression rule, and that's a Medicare established suppression rule, which says that in order to be displayed on our website, or in order to be reported on in general, even if it's not in a report in this manner, there must be 11 or more episodes or instances of that imaging service in our data in order to be displayed. And that's just a HIPAA rule and good practice to make sure that there are enough claims to make that available in any kind of reporting. So the reason that you may not be, you might say, well, I do plenty more than 11. You have to consider that, number one, we don't have all of those commercial claims. We're looking at about 65% of those commercial claims, so not all commercial claims are coming in. And as they come in, we do a lot on the front end when we receive claims from health insurance payers to process them and scrub them. So some claims get kicked out automatically because they may not meet our data requirements. So the data quality team that we have does a lot to make sure that the claims that are coming in are according to the specifications that we have. So some get kicked out for that. Prometheus episodes are also going to eliminate more claims than those imaging instances, because the Prometheus bundle must have all portions of that bundle in order for that claim to get included. So you may have more claims, but it may not include enough data on the pre and the post-op in order to be included in the bundle. So when you look at actual volumes, which if you're interested in your volumes, we're happy to help you guys understand the volume of claims that you have and the data that's going to be provided. But a lot of times you will see that those claims don't reflect your actual volumes because, again, they have to meet all of those criteria so that they're comparing apples to apples. Also, we have billing practices that sometimes are not in alignment with being able to accurately attribute a claim to your facility. So an example is Centura has some claims showing up in our database that are attributed in our data according to the claim that associated with Porter Hospital. Well, Porter Hospital doesn't do births, they don't do delivery. So we have some claims that are showing up for them that say that those were done at Porter. So sometimes the billing location isn't reflected accurately, and that sometimes will result in a fewer amount of claims being attributed to your facility. And then the other reason why some places might not be listed, you'll notice if you look at imaging, which a lot of physician offices do imaging services, we can't actually display any physician office-based price information because of a Colorado law that says that if you are going to share price information at the physician office level or for physicians, you also have to have an associated quality measure. Well, as you're probably aware, there isn't publicly available quality measures at the physician office level at this point in time. Civic can develop quality measures, and we have developed some quality measures, but we're not at the point yet where we are ready to provide that quality measure at the physician office level. So we're at this point in time not displaying any physician offices. And again, as I mentioned, if you guys have any concerns about any of the services that you see and not being displayed for one or more, or being displayed for one that doesn't make sense for your facility, please contact us at info@civic.org, or myself or Maria. Our information is going to be at the end of this slide deck. We'd be happy to check into that a little bit further if there's something that doesn't make sense to you or you have concerns or questions about any of the volumes. And then another question that we've received a lot is, making sure that patients understand this information. As I showed you before, our current reporting, and we are going to be doing this again, includes the considerations right at the top of the report that we know are important for people to understand as they're looking at this data. We want to make sure that we'll reflect that the prices are totals between what they would pay and what their insurance would pay, that they're estimates only, that they're really intended to give people a high-level understanding of what the total price would be, but then for more current and more specific pricing, because we're always going to be at least a year in arrears with our claims data because we need the full calendar year, and we have at least 6 months of run out in our claims data. So we'll always be a little bit in arrears as far as what year we're providing. So we want people to make sure that they understand that and that they need to really ask their insurance company or contact you guys at the facility level specifically for most current price estimates. We will want to also make sure that people know that the Prometheus bundles are the all-in estimated cost, that the imaging is only the facility payment, and then we'll have all links to very consumer-friendly FAQs and methodology, again, so that people can dig into what the data represents in more detail if they have that desire. And just some other quick notes on public information. Also on that tab that I showed you under the public data, we have other interactive information that might be of interest to you guys, and I just want to make sure that you are all aware of what we have. So again, we have the consumer shopping tool that we've talked a lot about today, but we also have population level tools as well, including a cost of care report that shows cost of care per member per year by county and geographic region. That's broken down by what the health insurance payers pay. You can look at Medicaid and commercial payers and Medicare Advantage. We have all of that same information across trends. So from 2012 to 2015, we'll be updating all of these reports later this year as well. We also have quality information, utilization information that shows readmissions, ER visits, things like that. And then we also have condition prevalence data as well available at the population statewide level. And then our most recent report that we released is a reference-based price report that might be of interest to you guys. It has the top inpatient, outpatient, and professional codes that we see in the state, and it breaks it down by the variation between payers, what they're paying compared to Medicare, and then also facilities, what you're getting paid compared to Medicare. So check those reports out if you're interested, and if there's ever anything that you're not sure if we have available and you don't have time to dig around on our website, you can always feel free to contact us directly. There's a lot of information out there that we want to make sure that it gets utilized across the state. So please check it out. And this is our information directly. So Maria's information is there, and my email address is there as well. We would love to answer any questions you guys have today, but once you start looking at this information a little bit more, if you have more questions, please let us know. We're here to answer anything that you may have. And then we also are willing to meet with you guys as well. We would request, I know it's soon, but by Monday or early next week, if you do want to schedule a meeting with your facility directly, we'd be happy to schedule an in-person meeting or something via Zoom like this now directly with your facility if you have questions regarding your particular prices or claims or anything related to this information. So that is all that I had today for you guys. I'd be happy to answer any questions. I don't see anything that has come across the chat, but please feel free, either the Q&A or the chat buttons. Again, if you have any questions for me, be happy to answer that. And I am also going to be sending this PowerPoint presentation to all of you on the phone right after this meeting. So you'll have this information available if you want to reference it later. We're also recording this information in this webinar, so it'll be available later as well. I'm not seeing anything so far. No questions. Hopefully that means that I answered any questions you may have had coming into this webinar. Hopefully there's a greater understanding of what this is, what it represents. And again, as I know, as you get into the data a little bit more, you may have more and more questions. But we appreciate you guys coming today and hope you had a happy holiday season and wish you an excellent 2019. And we will talk to you later. Thank you.